Most people think they know what a seizure looks like until it actually happens. And when it happens in front of you, perhaps it's someone you know, someone you're close to, our first reaction isn't action, and understandably so, it's panic. Today on Health Mantra, we're going to be talking about epilepsy. I'm Heather, and joining me today is a man who has spent over 4 decades inside the human brain. Dr. Audumbar Netalkar, a senior neurosurgeon from Manipal Hospitals, Goa, is a man whose hands have held over 45 years of surgical expertise, from operating theatres across Goa and Mumbai to fellowships in Germany and the Royal Preston Infirmary in the UK. Now, today he's here to tell us all about epilepsy, with clarity, with compassion, and with the authority of someone who's seen it all. From microscopic brain surgeries to complex procedures, his hands have restored what many thought was lost. Dr. Netalkar, thank you so much for joining us. We are honored to have you here with us.
Thanks for calling me. I appreciate it.
Doctor, a lot of people think they know what epilepsy is. However, there's so much confusion around it. Could you tell us what exactly epilepsy is and how is it different from, say, a one-off seizure?
Yes, epilepsy primarily is a brain condition. It's not any other part like spine or abdomen involved. It's a brain condition wherein there is an abnormal electric activity in the brain resulting into unconsciousness and movements of the hands and limbs, or either motor or sensory symptoms. You may get some tingling numbness, you may get tonic-clonic movements, or the body could become stiff. Either it could be loss of consciousness or without loss of consciousness. So that is called as epilepsy. Now, this epilepsy and seizure difference is if there is just one activity, motor activity, then it is called a seizure. And a person suffering from epilepsy is a multiple episodes, 2 or more seizures with beyond a 24-hour difference. It should not be within 24 hours. That is termed as epilepsy. So child has just one seizure and nothing after that, not epilepsy, but has once a week or once a month seizure.
If there's a recurring pattern.
Recurring pattern.
Now, what could be the cause? Some blame stress, others say it is trauma. Is there a clear reason why somebody would be suffering from epilepsy?
Yes, most of the time there is a clear reason, almost 70 to 80% of the time. In 20% of the time, it could be just unknown reason. It just happens out of the blue. But most of the time, the commonest cause over here is severe head injury. Most of the head injury patients who have lost consciousness, they suffer from epileptic seizures for some time or rest of their lives. Then the presence of brain tumors or a stroke. And then there are various congenital or genetic disorders, right from the birth or inherited from the hierarchy that can cause epileptic seizures.
We often hear that epilepsy is forever. Parents wonder, if a child has epileptic seizures, are they going to be suffering from it forever? Is it lifelong?
Epilepsy is generally lifelong. There is no cure, there is only control. That means if you do not take the medicines, epilepsy is not going to be controlled. So there is only a control, no cure. However, if you are very regular in taking medicines and you have no seizures for 2 years, 3 years, 5 years, sometime in some children you can stop it. And maybe hardly 5 to 10% of the patient may not need any more medicines. But generally, it's not a curable disease.
So it's all about management.
Yeah, it's all about management and how well you take care of yourself or your family.
Let's talk about how it shows up. Now, we see, there's television always showing us that seizures are violent. There's violent shaking. Is that how it is in every case?
Yeah, there are many types of seizures. There is a broad classification. One is a generalized and other is a focal. Generalized is where both the body parts, hands and legs, are shaking. There is frothing at mouth, there is clenching of teeth, and loss of consciousness. Where focal is just one hand is moving, either left or right, or leg, or flickering of the eyes. That is second type.
Okay.
Then third type is the focal becoming generalized, initially starting as focal, and
And if you
then
don't
the
catch it in
entire body
time.
is involved. Fourth type is an absent seizure. The patient
Okay.
will just grow frozen in his looks and won't know what is happening around. You know, these are mainly the four types of epileptic seizures that you can have.
I think that's a very important distinction, because if we only expect the dramatic, violent seizure ones, we might actually miss, when it happens, the small
Yes,
blackouts, the tiny
silent
little just
seizures.
staring into
Empty
space.
space.
Sometimes people do that. If you have a tiny blackout, or you think it's just fatigue, or it's just stress,
Yeah.
and many people tend to ignore these symptoms. What should they do if they don't realize it, or they think that they may have suffered an epileptic seizure?
Yeah, if there is a doubt regarding epileptic seizure, they have to consult a neuro specialist, either a neurologist or a neurosurgeon, and they should get first of all properly verified information. 90% of the epilepsy diagnosis is only by talking to the patient. You may
Okay.
not even get any symptoms signs afterwards, if the
Okay.
patient comes to you. Only what patient has suffered, he can narrate the experience to you, you diagnose. There may not be any imaging or any diagnostic test showing positivity, except when you talk to the doctors. Doctor can easily make out 90% of the
So are
time
you
that.
trying to say that it would not show up in any EEG
No,
or?
it may not. 50% of the EEGs are normal in
Okay.
Pro 1 epilepsy cases, who may get every month or every week also.
And then what does treatment involve? Is it just medication?
So see, we need to divide this into primary and secondary epilepsy. Primary epilepsy is the epilepsy without any obvious cause, like a brain tumor or a head injury. The secondary epilepsy is following the head injury or a brain tumor presence or a stroke. So if it is a primary epilepsy, we just need to first do the test called as electroencephalogram, EEG. It is like ECG of the brain.
Okay.
You know how we do ECG by sticking certain electrodes on the heart area and picking electrical activity. The brain has four types of electrical activity.
Okay.
Yeah, alpha, beta, delta, gamma. So these electrical activities are shown normally when you put those leads and record. In epileptic seizures, you can get spike and wave sort of a feature which
Okay.
clearly diagnoses epilepsy.
Does this spike show up only when a patient, like if you're doing an EEG at the time when a patient is suffering a seizure, or even after a
No,
seizure?
it could be even in interictal phase, then it helps. But many times they can be shown within first 24 hours after a seizure.
Okay.
So this is for the primary epilepsy. For secondary epilepsy, we need to do a CT scan or MRI scan to
Okay.
prove that there is a stroke or a brain
That has
tumor,
happened.
and then treat that secondary cause, which will in turn make the epileptic seizures vanish.
All right. Doctor, you're a neurosurgeon. You've got
Yes.
over 22 years of experience in Goa. At what point does surgery become part of the conversation?
Neurosurgery is a very small component of entire epileptic gamut, and it could be indicated in not epilepsy itself is just 1% of the population, but even 1% for a population for a country like India
Is
is a
huge.
huge. India, the total world population has got about 50 million, 5 crores of cases,
Okay.
of which 1 million, almost 1 crore is 10 million, 1 crore is from India.
India
So
alone.
one-fifth population of epileptic patients are from India. So of these, hardly 1 or 2% may be indicated for a surgical intervention. And this surgery has developed only in last 10 to 15 years.
Okay.
Before that, there wasn't any epileptic surgery possible. So the surgery is the last resort for epileptic seizures.
Okay.
If the epilepsy is controlled by medicines, one medicine or two medicines, there is no
Okay.
indication. If the patient needs three or more anti-epileptic medication, these are called, or the patient doesn't get any control even after four medications. So that is a refractory epilepsy. In case of refractory epilepsy, epilepsy surgery is indicated.
Okay. Now, you said something about India having 1 crore of epileptic patients. Now, I would assume that this 1 crore is those that are diagnosed. But there are a lot of cases that go undiagnosed, especially in rural areas. Is there anything that we can do to create awareness?
Yes, it is a must that we must create awareness, because in rural areas as compared to urban areas, only about 90 or 10% patients are under treatment in rural areas, whereas in urban areas there will be almost 80% patients treated. That's because of the various
So there's a big
misconceptions.
gap in rural
Yeah,
areas,
there
is
is
what
a
you're
big
saying.
gap in treatment, so awareness has to be spread.
uh, Another question that I had was, people often ask, that can somebody who suffers from epilepsy live a normal life? Can you travel? Can you work? Can you drive a car? Is that possible?
Most of the patients, almost 80% of the patients with epilepsy under treatment lead a normal life. So there is no issue about it. Only patients who are refractory epilepsy, even with treatment, they are not under control, having once or twice a week epilepsy, such people are at risk. 80% of the people lead a totally normal life.
Okay. Now, just last week there was an incident. There was an incident where a boatman in the Ganga suffered a seizure mid-river,
Yeah.
and people on the boat, nobody knew what to do. They panicked. Could you tell our viewers, if something like this happens in front of them, is there any immediate first aid that we can give? What are the do's that perhaps help a patient?
Yeah, that's a very important point, because most of the people, if they have not managed properly at the first instance, can have a big disastrous consequence. First of all, whenever you see epileptic seizure, you have to just make the patient flat on the ground, and you should not be crowding around them. You should leave a lot of space for the oxygen to come in. Once that is done, then make the patient lie on one side. Because if he lies on his back, if he has eaten something, he will start vomiting, and that vomitus will go into the chest, and that can be life threatening. Having done that, you do not restrain the patient. Let the patient have epilepsy. Let him have a seizure, maybe lasting for a minute or two. Do not restrain him. If you restrain him, he can land up with a fracture of the limb also, because it's a
Okay.
violent activity. And do not introduce any object in the mouth. Some people, they try to put something in the mouth. If the tongue comes out, just push it in, but do not put your finger or any object inside.
Okay.
And within a minute or two, it will get under control. Then go to the nearest local doctor, who will give an injection to prevent further attacks. This is the basics of first aid for epilepsy patient.
I think the most important, what doctor has said, is don't put anything in their mouth.
Yes.
Don't restrain the patient, which is what we normally see on television and all of the dangerous advice, so to speak, online.
Yes, yes.
Doctor, what about from a patient's perspective? Say a patient is suffering from epilepsy. Is there anything that patients can do to reduce incidences? Any precautions that they can take?
Yes, this is an important question, because most of the time people don't know what to do and what not to do if they have epilepsy. First of all, they should never miss a single dose. And at the correct timing he has to take. If he's taking 2 medicines a day, it should be 12-hourly interval.
Okay.
If he's taking 3 medicines a day, it should be 8-hourly difference. Half an hour here and there in okay, but not more than half
So
an
if you're
hour.
taking it at 8 o'clock and say 8 o'clock, you need to take it at
Yes.
the same, at
If
a
you
fixed
take
time.
at 8 o'clock, after 8 hours, it will be 4 o'clock, and after that, it will be 12 at night. This has to be maintained. Because I have seen with my vast experience, even if you do miss one dose, or you take a dose an hour later, you can get a fit.
Okay.
Okay. Secondly, having done that, avoid the smartphone. and LCD screens too much during the day.
So bright light.
Yeah, not only bright light, these LCD or smartphones are flickering pixels.
Okay.
They go on and off, on and off. This pixel shining into causes a lot of activity into the occipital area of the
Of the
brain.
brain.
Yeah, visual area, and that can incite seizures. Thirdly, he should avoid empty stomach in the morning. As soon as he
Okay.
wakes up, within half an hour, 45 minutes,
Hmm.
he should have a proper breakfast so that he gets the glucose. Brain cells only depend on
On
glucose. They
glucose,
don't depend
yes.
on any other nutrition. That is that. Fourthly, he should avoid late night sleeping, or he should avoid sleeplessness, like a person who goes for some function, whole night is away, has not slept. These are prone for epileptic seizures. And fifthly, we say if you are going on a beach, you are exhausted, heavily sweating, electrolyte imbalance comes. And these are the patients
Okay.
who can have epileptic seizures.
What about things like other, I know you said about lack of sleep, but what about things like alcohol? Can this also trigger
Yes,
a seizure?
correct. Excess alcohol can potentiate and give rise to seizures. Also, the medicine effect, if excess alcohol is taken, may not be as good as when alcohol is not taken. So, alcohol should be totally avoided. That is one thing. And you should all avoid the energy drinks.
Oh, yes.
Energy drinks with heavy caffeine. I have had one or two patients who had, after drinking for 2 weeks, he joined a five-star hotel.
Okay.
Every day he used to have two energy drinks. Within 2 weeks, he started having epilepsy. And
Oh.
now he is under treatment for last 10 years.
This is someone who's never had an epileptic
Never had
fit
an
before.
epilepsy. Yeah.
Oh,
There was
that's
no reason.
scary.
Yeah, it is. These
Uh,
energy drinks are very
What about
risky.
someone who's, say, not had epileptic fit in years? Can they stop treatment? Can you stop medication, or is that risky?
Yeah, there is a particular way. It is not given in books, but everybody's experience is very important. If the patient has just two epileptic seizures, well controlled, with a good compliance, he takes regular medication. If there is no epileptic seizure for 2 years, you can do an EEG and
Okay.
see that there are no spikes. If that is there, you can slowly reduce and
Phase
stop the
out your
medicine.
medicine.
If he gets a fit, then he should restart it and continue for next 5 years. So first 2 years, then 5 years. Then
Okay.
again you reduce and stop the medicines. By that time, if there is no epileptic seizure, you can just say that he is free of epilepsy. But if he has got a seizure, then after 5 years, generally it is lifelong treatment that is required.
Okay, and all of this reducing is under doctor's advisement, of
Supervision.
course. Yes.
Under supervision.
Doctor, let's do a quick round of myth versus fact. So I'll give you a statement, and you can tell us very briefly whether it's a myth, whether it's a fact, and something to support it.
Yeah.
So the first one is myth or fact: a seizure, and this is something that is very, very, common in rural areas. A seizure means that a person is mentally ill.
Yeah, this is the total misconception. Seizures are sometimes branded as mental illness or some possession of evil spirit. Both the things are wrong. A person with seizure could be mentally abnormal, and which the incidence is like general population only. By itself, seizure do not give rise to any mental illness. So that's a myth.
It's a myth. Okay, the next one is myth or fact: women with epilepsy shouldn't get pregnant.
No, that is a totally false statement. Women with epilepsy can very well have children, even when they are on medication for epilepsy. Only thing, certain precautions need to be taken, that they are more prone for risk associated with delivery, mother as well as child. They are more prone for bleeding disorders during the
Okay.
delivery. They are more prone for epileptic seizures. All this can be treated, and you can have a perfectly normal delivery, and you can have a normal child.
I think
Even
that's very
epilepsy.
good news.
Yes.
Doctor, myth or fact: seizures can cause permanent brain damage.
A seizure by itself doesn't cause any permanent brain damage. If you have a series of seizures without any recovery of consciousness, loss of consciousness in between. Suppose you had 3 seizures, one seizure unattended, 3 to 5 seizures with no recovery of the consciousness in between can give rise to severe brain damage.
So basically, if the brain is not getting any oxygen.
Yes, because the lack of oxygen can cause severe brain injury, and patient can be even vegetative and go on a ventilatory support. So even one seizure need to be treated immediately.
So go see a doctor immediately.
Yeah, nearest doctor immediately and get it addressed.
Doctor, myth or fact, anti-epileptic medications have severe side effects?
Anti-epileptic medicines do not have severe side effect, except one or two where some blood count may be less, but every doctor keeps a periodic check on the blood counts, and some medication may affect the liver functions. These are
Okay.
the two side effects, but they can very well be managed by doing regular tests, and almost 80 to 90% of the patient on medication do not have side effect as far as we are concerned.
So go take your medicines.
Yes, correct.
The last one, myth or fact, epilepsy can be faked?
Epilepsy as such cannot be faked because there are something called as hysterical fits, which is now called as a conversion disorder, which is a mental illness. But if there is a loss of consciousness and fraud, and there is a tongue bite, these are the three things which cannot be faked. So if there is a tongue bite, if there is loss of consciousness and froth coming out, it is 100% epilepsy.
Okay. Doctor, you've seen decades of change you've been practicing for the last 45 years, in Goa itself for the last 20 years. Why do you think there is a stigma around epilepsy? Is there anything, if there's one thing that you would like to say to our audience about the fear, about the stigma, what would it be?
Yeah, the fear and the stigma is because of the social belief that these are mental illnesses or by evil possession. Nothing of that sort. An epileptic patient can live a normal life. You have to go ahead out in the wide world and prove yourself. Many of the epileptic patients have been geniuses, and many have been top sportsmen. So epileptic person can access in any field. He can excel so much that he could be one of the prized possession of the society. So there is nothing, no stigma should be attached. An epileptic person should not have any negative impression about himself.
One last question, Doctor, before we finish up.
Yeah.
To our viewers who are watching, maybe they've just been diagnosed with epilepsy. Maybe someone they love has been diagnosed with epilepsy. What would you like them to know?
Yeah, as soon as now I have told you the various features of epilepsy. If there is any of these features, sometimes they are very subtle, like we diagnose some headache, which is like migraine, or somebody staring in space, not knowing what he is doing. If these are the conditions which are met, we have to consult a neuro doctor immediately. Of course, the major fits and all will immediately take a patient to the doctor. But these subtle signs, they just need to be addressed to. And the epilepsy can be completely controlled without many side effects of the drugs. And the patient can lead a normal life, even with epilepsy.
I
Nothing
think
to worry.
what doctor is saying is awareness is key.
Yes.
And it's the quiet ones rather than the violent episodes that need to be detected.
Yeah, they go unnoticed.
That they go unnoticed.
Yeah.
As doctor has said, with the right diagnosis, with the right treatment, epilepsy can definitely be managed, treated, and life can go on. It just finds a new rhythm. Thank you, doctor, so much for joining us here, for the decades of healing and for helping us mitigate the fear.
Thank you. Thanks to you.
So if epilepsy is part of your story, don't be afraid to ask questions, seek help, get the treatment you need. Dr. Audumbar Netalkar is available Monday to Saturday, 10 a.m. to 1 p.m. at Manipal Hospitals in Donapaula, Goa. Thank you all for tuning in. This is Health Mantra with Manipal Hospitals. I'm Heather. I'll see you next time only on Prudent Media.